Hi everyone, welcome to a joint effort, our preoperative class for patients scheduled for joint replacement surgery at Enloe Medical Center. My name is Flora McNeil and Kristen Davidson and I are the liaison nurses for the program. We look forward to getting to know you and helping in any way we can. Please feel free to use the business cards included in your class packet to contact us if we can be helpful to you or your care partners before or after your surgery. One tip, keep an eye out for the helpful hints sprinkled throughout the class content. They are answers to frequently asked questions patients have brought to the class through the years. If you need time on any given slide, just press the pause button and press play when you are ready to resume. Due to COVID-19, some of the class content may be temporarily out of date. Please always follow the latest guidance from your surgeon's office and the Enloe staff with whom you come into contact prior to your surgery day. Let's get started. This class has two goals. One, to give you information you can use to make informed decisions about your healthcare. And two, to invite you onto the team. We may be the experts on your surgery and recovery, but you are the expert on your body, and we can best help you if we know what you need from us. If you'd like to fill out the What Matters to Me form in your packet and bring it with you to the hospital, we will post it at the head of your bed for use during your stay. It provides a quick cheat sheet for your preferences to all staff entering your room. The middle bubble is your preferred name, and the remaining bubbles are your choice. Patients often list allergies, their motivation for surgery, etc. There are some starter questions on the back to get you started. One note, it's easier for us to read if you use a Sharpie or a felt tip pen. The agenda for the class is designed to be chronological, pre-hospital through your discharge home. There is a big team working to ensure a good experience and, most importantly, a good outcome for you. Some of us you will meet, some of the team will work behind the scenes, but please know, there's a big safety net working for you throughout your surgical journey. By now, you should all have met your surgeon and discussed joint replacement surgery, even if you haven't decided on a date yet. You will have an appointment within a few weeks of surgery, and this is the appointment where all paperwork and questions should be addressed by the surgeon and his staff. All Enloe joint replacement patients will be seen at eSpa within 3 weeks of surgery for preoperative diagnostic testing and information gathering. Your surgeon's office will provide you with the dates and times of these appointments. One word about home medication lists. You must have a list of all medications that you put in or on your body to change the function of your body, whether they are prescribed, over the counter, oral, topical, inhaled, everyday, or occasional use. This list should come to every appointment with you, and you should bring it with you to the hospital and keep it with you throughout your stay. Because this is elective surgery and you have the luxury of some time to plan ahead, there is some homework for you to get ready. This slide and the book provided to you by your surgeon's office contain useful information for your recovery. Have your care partner check the care partner checklist for things they can do to assist you. But remember, preparing for surgery is your responsibility, and it is important to take it seriously. Part of your homework is making sure your home environment is safe for the way you will move and think postoperatively. Our number one goal is preventing falls, so plan ahead to be safe. Tripping hazards, relocation of frequently used items, and arranging for assistance at home should all be done before surgery. Someone should be with you for the first 72 hours so that you can take your first shower, have your first home health physical therapy session, and develop a routine for all elements of your recovery: walking, exercising, icing, elevating, resting, and pain medication usage before you're spending substantial amounts of time on your own. If you have not received an assistive device, for example, a walker, wheelchair, or specialized cane, through your insurance or Medicare within the last 5 years, and you are having a knee or hip replacement, a front wheel walker is covered as part of your surgery. Otherwise, it is your responsibility to rent, borrow, or buy a front wheel walker prior to surgery day. Only a front wheel walker may be used after surgery. No 4-wheel walkers, 3-wheel walkers, walkers without wheels, or crutches, although your physical therapist may eventually transition you to a cane. If you have a walker prior to surgery, please do not bring it to the hospital with you. We will have a loaner for you to use while you are admitted. The Iceman cryocuff machine will go on in the recovery room and stay on throughout your hospital stay. It will go home with you, and it or some other means of icing the surgical site should be used for several weeks after surgery. The Iceman is safe to use continuously without risk to the underlying skin, and you will receive instructions on how to use it before you leave the hospital. Please see your shopping list for a handy tip on water bottles that may be frozen and used in place of ice cubes in the Iceman. This will make you much more independent when it comes time to refill it. The following equipment is not covered by Medicare or insurance. Again, it is your responsibility to acquire this equipment prior to surgery if you anticipate needing it during your recovery. Much of this equipment is available for purchase online, secondhand, or at drugstores, for purchase or rental through Enloe Home Medical and other medical supply stores, and can often be borrowed from friends and family. Be sure to ask around. Many of our patients find that using a bedside commode frame as a toilet riser is useful, since the height can be adjusted. We do not recommend using it as a bedside commode. Getting up and walking to the bathroom is an important part of your post-op exercise regimen. Occupational therapy is the discipline concerned with ensuring you can perform basic daily activities. They will see you 1 to 2 times while you are in the hospital and may recommend assistive devices if they feel they would be helpful to you after surgery. If needed, home health occupational therapy can be ordered along with your home health physical therapy, although this is very rare for our patients. If you are independent in your activities of daily living before surgery, we expect that you will be independent after surgery as well. Here are some examples of occupational therapy aids. Again, these are considered non-essential items and are not covered by insurance or Medicare. Pre-PACA or pre-op at the main hospital will call you the business day prior to your surgery day in the afternoon or early evening. It is crucial that we have the correct phone number or numbers on file for you. If you have more than one number, it is important that you tell us which is your preferred contact number and that you are available at that number when pre-op calls you. Please travel light when you come into the hospital on surgery day. Photo ID, insurance cards, home medication list, and a completed advance directive if you have one. Please do not bring cash, credit cards, or jewelry to the hospital with you. You should not bring any home medications unless your surgeon's office has instructed you to bring a non-formulary medication in its original pharmacy bottle for use in the hospital. The north entrance is on the west side of the hospital, 1 block north of the main entrance, on what used to be the corner of 6th and Magnolia Avenues. As soon as you have registered, we will take you back into the pre-op area along with one care partner. The bays are small and we need some room to work, but once we have finished getting you ready, you are welcome to have multiple care partners spend time with you before you go into surgery. We will give your belongings to your care partner for safekeeping while you are in surgery, so please leave bulky items in the car when you enter the hospital. Storage lockers are available in the recovery room for patients who will not have a care partner with them on surgery day. You will meet your anesthesiologist and go over the anesthesia plan during your time in the pre-op area, but this is typically a brief interaction. If you have specific questions regarding anesthesia, please ask your surgeon at your pre-op appointment in the surgeon's office. You are awake in the operating room for the spinal placement, but otherwise asleep during surgery. If you've had surgery in the past, you'll remember that you wake up with spaghetti everywhere and a nurse at your elbow. Because we use a combination of anesthesia methods, pain and nausea should be minimal to non-existent when you wake up from surgery, but your bedside staff is available for anything you might need. You won't be here long, and your care partners will see you as soon as you're in your room upstairs. Good news. Unless you choose to have a care partner stay with you, you will have a hospital room all to yourself. No shared rooms for surgical patients. Physical therapy will see you within 1 to 2 hours of getting to your room. Remember those precautions and exercises. You will be asked frequently to rate your pain. This is necessary for documentation and medication administration. We don't have a specific number in mind as a goal. What is important is that your pain is managed well enough that you can move your body, rest your body, and nourish your body. Pain that interferes with any of these essential activities is a rationale for pain medicine, and your pain management plan contains several classes of medications as tools in the toolbox and starts before your surgery. If you have concerns about opiate or opioid medications, please discuss them with your surgeon prior to surgery day. Discharge criteria from the hospital are fourfold. Both the surgical team and physical therapy team play an important role in documenting that you are ready to return home. Only patients that the team feels are unsafe to discharge home will be considered for discharge to a skilled nursing facility or nursing home. Discharge home is almost always the preferred discharge plan for joint replacement patients. Not wanting to bother anyone and ask for help is not a good reason to anticipate discharging to a nursing facility. If your surgeon talks about sending you somewhere for rehab, he means a nursing facility. With rare exceptions, Enloe inpatient rehabilitation on East Avenue is not covered for joint replacement patients. Before discharge, your physical therapist and bedside RN will go over important information with you and your care partner. Please ask as many questions as you need to, care partners too. Constipation is an almost universal experience after joint replacement surgery due to the use of anesthesia and pain medicine and the fact that you are not as active as you would normally be. You have a lot of control over whether constipation is mildly annoying or becomes an acute problem. Your shopping list contains over-the-counter medication recommendations. Pick these up and have them on standby at home for use after discharge. Constipation, not pain, is our #1 complaint after joint replacement surgery. Shop ahead of time, and if you don't eat a nutrient-dense diet normally, practice ahead of time and learn some new recipes. After discharge, the liaison nurses will call to check on you, and knee and hip replacements will have home health physical therapy starting within 24 to 48 hours of discharge. It is important that you know who to call if you have questions or concerns. This slide provides a quick guide to your resources for help if you need it. Since we won't have a chance to meet you and answer questions in person, please feel free to use the business cards in your packet and reach out to us if we can help in any way. We are in our office at the main hospital Monday through Friday, and we're happy to help. This concludes the liaison nurse portion of the class content. Please click on the link for your surgery type to see important information from our physical therapy department regarding your recovery. Our expectation is that you will learn your precautions and exercises prior to your arrival at the hospital and be able to demonstrate them to us when you work with physical therapy for the first time on the day of surgery. Have fun learning, and we look forward to meeting you soon.